Cardiovascular disorders are taking epidemic proportions not only in India but across the world. Today, on the occasion of World Heart Day, we from Care have come to Dr. Harsh Wardhan, Head of Cardiology, Primus Super Speciality Hospital, to get an insight into what this disease is all about, what we need to do, and how do we take care of ourselves. Over to Dr. Harsh Wardhan. Good morning, Dr. Harsh Wardhan.
Good morning.
So we get to hear that cardiovascular diseases is taking an epidemic proportion not only in India but across the world. So in this context, what is the incidence of this disease in India?
You see, when we talk of the diseases that are taking epidemic proportions, we usually talk of diseases like the coronary heart disease, which usually manifest as angina pectoris or heart attack, which in medical terms is known as acute myocardial infarction, and high blood pressure, hypertension. Of course, there are other diseases of the heart like congenital heart diseases, then the diseases of the heart valves, which of course have been remaining almost stationary over the past few decades. But diseases of the coronary arteries known as coronary artery disease and hypertension are definitely on the rise and a matter for concern for us. If we see almost 10% of the adult population is suffering from coronary artery disease, that means blockages in the coronary artery disease, and another about 25% of the people are suffering from hypertension, the adult population. And the recent survey which was done by the Cardiology Society a few days ago, they have shown that almost 33% of the adult population is having high blood pressure, and a lot of them don't even know that they are suffering from high blood pressure.
So what builds to this cardiovascular disease, and what are the physical or bodily disorders that happen?
You see, if we see at these heart diseases, the blockages in the coronary arteries, they are because of deposition of cholesterol inside the blood vessels. And this deposition of cholesterol in the blood vessels causes narrowing of the lumen of the blood vessel, with the result that the blood flow in that vessel cannot flow properly. That means there is obstruction to the blood flow. So why this cholesterol deposit builds up? There are many causes, but there are certain risk factors which we know commonly, which increase the chance of deposition of these cholesterol. This we know as risk factors for development of coronary artery disease or atherosclerosis. The process of deposition of cholesterol in any blood vessels is called atherosclerosis. When they deposits in the coronary artery, we call it coronary artery disease. If it deposits in the blood vessels of the brain, we call it carotid artery disease. If they get deposited in the blood vessels of the other vessels, we call it peripheral artery disease. So wherever they get deposited, they cause obstruction of flow in that part of the body. But today we are talking about the coronary artery disease, where the deposition of cholesterol inside the blood vessel. The risk factors that we are talking are of two types basically, the modifiable risk factors and the non-modifiable risk factors. When we say non-modifiable risk factors, these are the risk factors which we can't modify. For example, our heredity, increasing age, the chances of this disease become more as the age advances, and the male sex. Male sex is more prone to get this disease in the adult life. However, female after the menopause, they also have almost the same risk as the male population to develop this disease. They are protected only till the age of menopause. So these are the non-modifiable risk factors. There are other important modifiable risk factors which are usually related to our lifestyle, how we live and how we eat, how we exercise. And these risk factors are cholesterol in the blood, the lipid levels. The higher are the cholesterol levels, particularly the harmful cholesterol, which we call as LDL cholesterol, the greater will be chances of developing this disease. Then the diseases like high blood pressure, diabetes, smoking, obesity, sedentary lifestyle. So these are the risk factors which basically increase the chances of getting these diseases.
So we are seeing that the youth are also becoming equally or more vulnerable these days. Any specific reason for that?
Yes, you are very right. The youth are becoming vulnerable, and we are getting patients at the early stages of life. Even people as young as 25, 30 years are getting heart attack, which we never used to hear about 3 decades ago. You see, if we see, the lifestyle of people have changed markedly, and these risk factors have increased. We have become more sedentary. Our diet has become rich in fats and cholesterol. There's more stress, there's more obesity, particularly the abdominal obesity, which we call as central obesity, which is a risk factor for heart disease. So the risk factors on the whole are increasing in adult population, and then the diseases like high blood pressure and diabetes, they are also an increase in our population. As I said, the recent survey has shown that almost every third adult individual is suffering from high blood pressure. Then the diabetes is on the rise to the extent that we say very soon we are going to be capital of diabetes. So all these risk factors are a matter for concern, and their increasing incidence is increasing chances of developing this disease even in younger adults and youth.
So most of the time we either ignore the symptoms or we don't even understand that something is building up within and might be fatal going forward. So are there any easy way to identify?
Yes, you see, I think before symptoms, I think we are ignoring the risk factors. We are totally ignoring our lifestyle. We are not taking care of risk factors. If we have to prevent this heart disease, first we have to take care of these factors. Now about the disease, yes, say risk factor, high blood pressure. Usually it doesn't cause any symptoms at all. It is a silent killer. It silently damages the body. So all we have to do is get our blood pressure measured, say once in a year, to find out that we are developing high blood pressure and detect it at early stages and control it. Then similarly diabetes, it may not cause any symptoms. Only if we get our blood tested for this, we will be able to control it in early stages. Similarly, the high cholesterol levels, we can do it only by measuring our blood levels. So most of the risk factors as such don't cause any symptoms. Sedentary lifestyles, we don't bother. We are in a race in the modern urbanized life and don't take care of our physical activity and spend most of the time living sedentary. So these risk factors we are ignoring. Then the symptoms. The early symptoms of heart disease patients may get, if the obstruction develops, may get some discomfort in the chest. When the obstruction is partial, the artery has not been totally blockage, we got symptom called angina. That means the patient gets symptom when doing certain exertion, say climbing stairs or running, one may get some discomfort in the chest or some shortness of breath. So these could be the symptoms of early development of heart disease, which many times we ignore. So these are the symptoms which we have to catch in early stage and get ourselves investigated if we get these symptoms. This is angina. You see, when the blood supply to the heart is all right, when we are sitting, means it is sufficient to give oxygen to the heart muscle. But when we are exerting, exercising, the oxygen demand of the heart muscle increases, and that time this partially obstructed artery is not able to provide sufficient blood. Now at one stage the obstruction is partial only, say 50%, 60%, 70%, 80%, and we are able to cope up with life. Then suddenly one day this atherosclerotic plaque or the obstruction rupture, and over that a blood clot forms, a situation we call as heart attack or acute myocardial infarction. In that case, when the blood clot forms over this blockage, that means the blood flow to that portion of the heart muscle gets totally blocked, and that is an emergency situation called heart attack or myocardial infarction. And many times we ignore that also. You see, acute heart attack is such a condition if the artery is blocked, and if you open that artery within 6 hours, the damage to the heart muscle can be minimized. You can understand that if the blood is not flowing to that heart muscle and you don't restore the blood flow to that portion of the heart muscle, that muscle will become permanently dead. And the time window is only 6 hours to open this artery. If we open this artery within 6 hours, we can minimize damage to the heart muscle. So the aim is to recognize the symptoms early and approach the medical facility early so that the artery can be able. Unfortunately, most of the people ignore that also. They think that probably the symptom that I am getting are because of gas. I ate something heavily yesterday, that's why I am feeling discomfort. And in the process, when the symptoms don't get controlled in 3-4 hours, then we rush to the hospital. And in the process, we have already lost that precious time. So we have to detect these symptoms early. If we are getting angina, that means any chest discomfort or any shortness of breath on exertion, we should get ourselves investigated by the doctor. And similarly, if we get any discomfort in the chest constricting type of pain or acute shortness of breath that we are feeling difficulty in breathing, and sometimes these patients get even attack of unconsciousness, etc. Whenever these symptoms occur which could signify heart attack, one should immediately approach the immediate medical facility so that the blocked artery can be opened and one can save oneself from the permanent heart muscle damage.
So I think not being able to identify the symptoms is in itself a self-defeating process that we get into. So from your position, would you suggest the viewers that they should go for a regular checkup so that medically they have a proof of what their condition is?
Yes, as I said that one should have a regular medical checkups. And medical checkup is not required basically to detect the disease early. It is also required to detect the risk factors at an early stage. Because the sooner we detect these risk factors and control them, the better we'll be able to prevent those diseases. As I said, most of the risk factors don't have any symptoms. Diabetes we can detect only by doing the blood sugar test. High cholesterol we can detect only by doing the blood sample test, and blood pressure also we can detect early only by measuring it. They don't cause any symptom. So we have to detect these risk factors at early stage. Consult the doctor, discuss with him your lifestyle, see what lifestyle changes are required in your life so that you can prevent this. So that's why the regular medical checkups are very important. Only when the doctor discusses with you the symptoms, if you are having any, and he suspects that you could be suffering from a heart disease, he will probably expose you to certain further tests to see whether you are really suffering from a heart disease or not, which may be an ECG, an exercise treadmill test, an echocardiograph, etc. if he is suspecting that there could be blockages in the arteries. So these tests help us to prove whether there are blockages or not, detect them early and treat them early.
So, while we are talking about tests, would you be able to highlight a little bit on the medical procedures or the treatments that are available today in terms of the advanced technology, in terms of the medicines, so that people get insight into what happens if they get to know that they are suffering?
You see, if somebody is suffering from blockages in the artery, the first responsibility of the patients as well as doctors to find out how much is the extent of blockages. And the various tests that are available to us, one is a simple ECG. ECG can tell you if somebody has got heart attack in the past. ECG will show it. Sometimes people get silent heart attacks. They may not have any symptoms. Small heart attack may occur and pass unnoticed. ECG will be able to show that if there has been any past heart attack or not. So ECG, but then there is a myth. In normal ECG doesn't rule out heart disease. Many times people think that my ECG is normal. It doesn't mean that he doesn't have a heart disease. As I said, in angina, the blockage in the artery is partial. That means only if somebody is exercising, at that time the changes appear in the ECG. That's why we do tests like treadmill test or a stress echo test. When the person is made to run on the treadmill and during that physical exercise, we monitor it by ECG or by an echocardiograph to see whether changes appear when the heart is put under stress. So when the changes appear in the ECG or echocardiograph, which we call a stress echo during stress, and then they disappear after the stress, that signifies that the blockages in the arteries has already set in. So when we know that the treadmill test is positive or stress echo is positive and the blockages have already set in, the next job is to find out what is the extent of blockage, because our main treatment will depend upon after finding what is the extent of blockages. So the extent of blockages can be identified by doing a test called coronary angiography. You see, coronary angiography is direct visualization of the coronary artery. Means you can look into the coronary artery, see and where all the blockages are. Coronary angiography is, I tell you in simple terms, nothing but an X-ray of the coronary arteries. Normally when we do a simple X-ray, we see just the bones, etc. and nothing else. But if we inject some dye, radio-opaque dye inside the coronary artery, we are able to see the arteries. So any visualization of the arteries by X-ray is known as an angiography. So when we are visualizing the coronary arteries, it is known as a coronary angiography. So to do that, we have to inject a dye into the coronary artery. So to inject dye into the coronary artery, we have reached up to the mouth of coronary artery. That we do by puncturing a small artery either in the wrist or in the groin, and through that we pass a very small tube called a catheter, which goes right up to the mouth of that artery. Through that catheter we inject a radio-opaque dye, iodine containing dye, and when that dye flows into that blood vessels, it causes visualization of that coronary artery. And then we can visualize the coronary arteries from different angles. The machine moves in different angles and see what is the extent of blockage. blockage may be 30%, 50%, 60%, 70%. It may be in one artery, two arteries, or three arteries. It may be affecting the main coronary artery, where it can be very dangerous. So we exactly assess what is the extent of blockages. Now, depending upon his symptoms, what is the state of heart muscle assessed on echocardiography, and the extent of coronary artery disease, all these data combined together, we decide the treatment of these patients. And the various treatments available for these patients are either it could be drugs, the medication, or one can do angioplasty, which we commonly know balloon angioplasty, or putting in a stent, where we open the artery non-surgically. That means through the same artery, as I explained during angiography, we pass a small wire. Over the wire we put in a balloon, and that balloon open up the blood vessel, and then we put a stent, which is a metal scaffolding in that artery, and that opens up the blood artery. Or we could treat these patients by doing the bypass surgery. You see, bypass surgery and angioplasty are basically to restore the blood. As if I give you an example, supposing a road is blocked and a dumper has been put in there and all the garbage is lying, option is either you remove that garbage and clear the road. That is what we do by angioplasty. Or other thing is you create an alternate road and the traffic can flow through that, and that is known as bypass surgery, in which we surgically create an alternate channel by putting in another blood vessels, and the blood starts flowing through that blood vessel and supply blood to the heart muscle, and thus the restoration of blood is there to the heart muscle.
Doctor, it is interesting to note you have been highlighting on the patient who is suffering. What about the family? What about people around him? Is there any advice you would give them by which they can identify that one individual might be in a vulnerable state?
Yes, you see, particularly in families where the heart disease is high, those family member has to be extra cautious. They need to be screened for risk factor more vigorously and treated for those risk factor at an early stage. Many times we think that probably the precaution for heart disease starts after heart disease has occurred. We start taking precaution for heart disease once the heart attack has occurred. That's not true. The process of atherosclerosis or deposition of cholesterol develops right in our childhood, and it gradually progresses. The more are the risk factors, faster will be this process, and earlier we'll get the heart disease. So basically the preventive treatment has to start early in life. During our childhood, we have to adopt healthy lifestyle so that the risk factors don't occur in our body and we can prevent the heart disease. So now those who have got already non-modifiable risk factors like heredity, they have to be more concerned. They have to detect their risk factors early, treat them more aggressively so that they don't develop this disease at an early stage. There are drugs, there are lifestyle measures, drugs which can reduce the cholesterol levels, etc. If somebody is found to have, say, very high levels of cholesterol, one can control these with drugs and thus delay the development of heart disease. Statin are the drugs which are given usually to the patients who have got very high cholesterol levels. They are able to control this important risk factor and thus delay the process of atherosclerosis and heart disease.
So you mentioned risk factor, you also mentioned lifestyle. Would you like to advise our audience on the lifestyle adaptation or the changes that people need to understand? Lifestyle that needs to be done away with and the lifestyle that needs to be incorporated on a daily basis.
Yeah. You see, by lifestyle I mean that one has to take care of his diet and exercise. You see, one has to take diet which doesn't increase his cholesterol level, which doesn't increase obesity in him, and which doesn't increase blood pressure in him. Having said that, to prevent obesity, we have to take calories. It should be a balanced diet, but also not too high in calories, so that we don't become overweight and we don't develop obesity. High blood pressure, people, salt is a very important culprit. To prevent development of high blood pressure, or if we have already high blood pressure, to control it, one needs to take less of salt. You see, most of the fast foods that we take nowadays, they are very high in salt content. Salt is usually used as a preservative. The stored foods that we take, these packet foods, the food packets, they are very high in salt contents. All these stored foods that we get in packets, they are high in salt and fat content. So we have to concentrate more on fresh fruits, vegetables, rather than the foods which have been preserved, like achar, chutneys, etc., which we relish, which can be stored for a long, and they are very high in salt content and also contain. So we have to avoid those type of stored foods and the fast foods which we commonly get, which have been fried. Another culprit is this fats. Now fats, we have to be low on saturated fats and take more of polyunsaturated fats and monounsaturated fats. If I say in simple terms, the saturated fats are those which solidify easily on room temperature, like the vanaspati, the ghee, butter, etc. These contain more of saturated fats. So we have to restrict them and instead take more of unsaturated fats, the oils which remain liquid at room temperature. So one is substituting that with unsaturated and take a balanced quantity of them. Then trans fats are very important culprit in our population. You see, trans fats are the one which are created when we boil the oil at a very high temperature. Most of the frying that is done is trans fats. When we use the oil repeatedly, it gets converted into trans fats. Vanaspati, when we boil it, it becomes a trans fat. So all the delicious dishes that we enjoy, the samosas, the bread pakoras, they are not, and the packet foods again, the bhujiyas, etc., they are nothing but trans fats and very harmful for the heart. So one has to avoid the saturated fats, the trans fats, salt in our diet, and also take calories in limited number so that we don't get obesity. So if we take care of these dietary factors, probably we could be assumed to be having a healthy diet. Right. So stress more on fresh fruit and vegetables, which we usually don't take nowadays, and take less of these things. Another important aspect of our lifestyle is the physical activity. How much physical activity? In the day of mechanization, probably our whole life has become mechanized. We get out from the home, sit in the car, go to the office, take a lift, go up, then come down, come back home, and there's hardly any activity in our day-to-day life. Even if I go to market 1 kilometer away from our home, we usually have a tendency to take a car and go to the market. So I think we have to bring physical activity in our day-to-day life. We always talk that one should walk for 30 minutes in a day, at least a brisk walk, and at least 150 minutes of physical activity should be done per week. That is the minimum that one should do. If many times excuses are we don't get time to go for a walk, we don't get 30 minutes, life is so busy, but then we can take care of this by imbibing physical activity in our day-to-day activity. If we have to go to a market a kilometer, we can go there walking. If we are in an office, instead of taking a lift, we can climb the stairs. Similarly, if we are going in an office, we can just get out of our car, say a kilometer before, and walk for a kilometer or so. So similarly, I think one can always find means to do some physical activity. Only thing is we have to be convinced that physical activity is very important for us. That will prevent us from the serious heart disease and give us a healthy heart.
So sir, awareness is the source of the safety precautions.
Yes, awareness is very important, because only if we are aware and convinced about it, we'll be able to adopt this healthy lifestyle measure. And that is where the media has got very important role, to make our people aware what are the risk factors for heart disease, how they should prevent heart disease, and what should they do once they get a heart disease. And being aware helps a lot in reducing this burden of heart disease.
Thank you so much, doctor, for giving us time, talking to our audience, spreading awareness, and we from MyNet Care really appreciate your time. Thank you so much.
Thank you. Good day.